It is 11:07, so I am going to continue to power through, but welcome to take more break if you need to. I just am committed to getting you out on time today at 12. This is our embryology review. After today, I won't review any more embryo. So this is our only embryo review that we'll do. This PowerPoint goes through the general concepts of embryogenesis, gastrulation, and starts organogenesis. I don't cover all of organogenesis in this PowerPoint. There's some more specifics on certain organs in the additional PowerPoint that's on Moodle. I'm not going to lecture on that here, but I encourage you to review it, especially if you're having trouble with the cardio organogenesis section. This does not go into oogenesis or spermatogenesis. That will be covered in the reproductive section. So this is past that. We're talking about from fertilization or really implantation forward. That's what we'll talk about here. So embryogenesis, from implantation, gastrulation, neurulation, and more. Week 1, when we're traveling through, we have our little secondary oocyte. Then we have a zygote. Then we start our 2-cell, 4-cell, our morula, our blastocyst. Our blastocyst during week 1 sticks, so implants on day 6. Okay, so week 1, day 6, that's when we stick the blastocyst. That's when we implant. All right, and this is day 1 through 7. This is our first week of development as an embryo. Around this time, HCG secretion begins when blastocyst implants on day 6. That's when you could start to see your HCG hormone being present. During week 2, we start to see bilayer formation. So you're going to see a bilaminar embryonic disc form during week 2. So week 2, you get 2 layers, an epiblastic layer and a hypoblastic layer. You'll see here, epiblast up top, kind of this greenish color, hypoblast below, this more orangey color. You'll see the hypoblast is going to actually encompass around what will be the yolk sac, versus our epiblast is up top. This will eventually become our 3 germ layers. Okay, so in week 2, we get 2 layers, epiblast, which is going to be your embryo, and hypoblast, which is going to be kind of more the support structures. Week 3, we get 3 layers. This is when we start gastrulation, is week 3. Okay, we get our trilaminar embryonic disc via gastrulation during week 3. So week 1, embryo sticks on day 6. Week 2, we get 2 layers, bilaminar disc, epiblast and hypoblast. Week 3, we get 3 germ layers, our trilaminar embryonic disc. We get ectoderm, which is going to be the overlying ectoderm. It's going to become our neural plate, neurulation, amongst other structures, which we'll look at. Our mesoderm is going to help form our notochord from midline mesoderm, as well as a bunch of other stuff. And then our endoderm. Okay, so these are our 3 layers from top to bottom. So we can see here ectoderm, mesoderm in red, and endoderm on the bottom. These all came from our epiblast. Okay, so ectoderm, mesoderm, endoderm. Okay, 3 layers. Week 3, trilaminar disc, 3 layers. All right, we'll see if we have it. During embryonic development, what event occurs on day 6? Implantation. It sticks on day 6. Implantation. Yes, don't write sticks, but yes, implantation. It sticks on day 6. Good. We implant on day 6 in the uterine wall. All right, so the ectoderm, we're going to look now at these germ layers a little more closely and look at their structures, because these are often NPLEX questions. This adult structure, what germ layer was it? So knowing what these germ layers, that's the ectoderm, mesoderm, endoderm, develop into will be helpful. So ectoderm thinks external or outer layer. So we have surface ectoderm. That's going to be your epidermis, your actual covering, your skin. Your adenohypophysis, your anterior pituitary, right? We mentioned that before. Your anterior pituitary is the weird one. It's the part of pituitary that's glandular in nature. It's the part of pituitary that doesn't come from the nervous system. It's ectodermal tissue. Your lens of your eye, epithelial linings of the oral cavity, sensory organs of the ear, olfactory, so epithelium stuff. Your glands, like your parotid, your sweat, and your mammary glands. And the anal gland more externally, below the pectinate line. So think about things that are on the surface for the most part, besides like the pituitary. That's the weird one, the anterior pituitary. You also are going to see the formation of the neural tube, neuroectoderm, and the central nervous system. So this is all ectodermal tissue. So we have surface ectoderm, which is more of like our surface coverings. We have our neural tube or neuroectoderm, our central nervous system. So these are our brain structures, the posterior pituitary, central nervous system neurons, oligodendrocytes are some of our glial cells that support our neurons in our CNS. The pineal gland, epidermal cells, the retina, and the spinal cord. This is all from ectoderm tissue, ectoderm germ layer, specifically rising off of the neural tube, which is a part of the ectoderm. This is all ectoderm, surface ectoderm, neural tube, ectoderm. And then we have our neural crest cells, which I mentioned before. These are our peripheral nervous system cells, as well as some non-neural structures that surround the peripheral nervous system. We're going to look at those structures on the next slide. But again, all three of these come from the ectoderm. So it's important to know they all have the same germ layer. They just form some secondary structures that are slightly different in development. So ectoderm cell or ectoderm germ layer that becomes neurocrest cells is going to create the peripheral nervous system and non-neural structures that surround. I could not come up with a better mnemonic than what USMLE came up with. So this is a USMLE mnemonic of talking about Elmo passing the street. They had a song even back in my day. I don't know. So Elmo passes you on the street. That's what this is about. Come up with a better mnemonic for me, that'd be great. But essentially, these are all the things that come from neural crest cells. A lot of them are peripheral nervous system structures, but there's some other different ones as well. Our enterochromaffin cells, our meninges like pia and arachnoid mater, our melanocytes. That's different. That's not peripheral nervous system. Odontoblasts, that's the outer portion of pulp that secretes dentin. Peripheral nervous system ganglia. The adrenal medulla, remember I said comes from neural crest cells. Your Schwann cells, which is a neuroglial cell. Your spiral membrane, which is going to actually become part of your heart. Endocardial cushions also will become part of your heart, and skull bones. So some random ass stuff that comes a part of our neural crest cells. These ones are easier to remember. Outside structures, really central nervous system. This is the one that gets a little funky. So if you can memorize this or come up with a way to remember some of the different ones that aren't peripheral nervous system, that will help you. It might also be easier to remember what's mesoderm and endoderm, and then just say whatever else isn't those things is this. That could also be a strategy. That was all ectoderm, okay? That's the biggest of them all. Mesoderm is our middle layer, our meat layer. It's our muscle, our bone, our connective tissue. It's linings of body cavities. It's the spleen. It's other structures of the cardiovascular system that we didn't already talk about. So what is that? We talked about the aortopulmonary septum, which will be fused with the interventricular septum. We talked about the walls and the septum of the four chambers of the heart. So these two things are ecto. Other cardiovascular stuff is mesoderm, okay? Lymphatics and blood, mesoderm. The wall of our gut tube, mesoderm. Proximal vagina, not external, proximal, mesoderm. Kidneys, the other parts of the adrenal cortex, the dermis, testes and ovaries, and tracheal cartilage, all mesoderm, middle meat tissue. We also have our dura mater, the one portion, the one meninge that was not ectoderm is the dura mater, and that's mesoderm. And then we have the notochord. The notochord is not a part of the nervous system. The notochord is from mesoderm. It's going to be a midline tube or a midline cord that's created to help to induce the ectoderm, the tissue layer that was on top above, to help form neuroectoderm tissue, the neural plate, essentially. It's going to eventually, the notochord, become the nucleus pulposus of intervertebral discs. So squishy part. So it doesn't completely go away. It doesn't have a lot of function or structure once we become adults, but it is really important in actually starting our nervous system development, which is one of the first organ systems that develops. So if we don't have proper notochord development from the mesoderm, we won't have necessarily proper neural tube development or neural plate development, which means our nervous system might have malfunctions or congenital issues, congenital malformations. And the last layer is the endoderm. This can be the internal or internal layer. This is our gut tube epithelium. It also will include the anal canal above the pectinate line. Remember, the one below was ectoderm, external, right? So this is the one above, so anal canal above the pectinate line. Most of the urethra, as well as the distal vagina, The luminal epithelial derivatives. So what does that mean? It means a lot of our organs are endoderm: lungs, liver, gallbladder, pancreas, our eustachian tube, thymus, parathyroid, thyroid follicular and parafollicular cells. So a lot of our organs and stuff are endoderm. It's the internal structures. So I think for me, when I learned these, the endoderm is the easiest one to remember first, it's the smallest. Then I remember the external ectoderm, because it's like the surface stuff, the epidermis, the kind of superficial things. I remember that ectoderm can be central nervous system based, and ectoderm that's neural crest cells is going to be peripheral nervous system based. Anything else that's more meaty is going to be mesoderm. And then the one thing you might have to memorize is what are the non-peripheral nervous system structures that are from neural crest cells, which is ectodermal tissue. Those are your germ layers. I would start here. So start in these first parts of your slide with your embryology study. If you already have this down, then move forward from here. But this will probably give you the most high yield from your embryology section. Okay. Yes. The mesoderm. Yeah. So the mesoderm organs, the middle or meat layer, I just think of things that are more internal or more centralized. So my heart, I remember as middle or meat because it's associated with the blood. So heart and blood, I just remember as mesoderm. Kidney, any kind of like structures that almost are kidney bean like. So your kidneys, your testes, and ovaries, I've like put them together in a category as mesoderm in the adrenal cortex. And then from there, it's kind of these other weird structures. When it comes to your endoderm, I don't have a great memory mnemonic for you. Sorry. I could come up with one. It'd be better if you came up with one for yourself, probably. Yeah. I do include mnemonics when I have them when I think they're good and I feel like they help you remember. But you can create a mnemonic for anything, right? So you could create a mnemonic on your own. There are mnemonic generators. And so you could always do that. So that's often helpful. You'll remember it better. I don't have a great one of remembering the endoderm. Yes. Please. Yeah. Yep. So our ectoderm neural crest cells. So again, neural crest cells are part of the ectoderm. So ectoderm will develop into neural crest cells. And then the two portions that are cardiovascular in nature is the spiral membrane and endocardial cushions. The spiral membrane will become the aortic and pulmonary septum. So aortico-pulmonary septum, that's what that will become, which eventually will become the interverticular septum. So between the ventricles. The endocardial cushions also have some mesoderm in them even, but endocardial cushions take some neural crest cells, will become the walls and the septum of your four chambers of the heart. So kind of the internal structures of the heart, the walls, the chambers, that's going to come from your neural crest cells. The muscle portion of your heart, the valves, the chordae tendineae, your conduction system, that's all going to come from mesoderm. Does that help? Yeah, absolutely. It's a good clarification. Any other questions about germ layer? Yes, please. Conduction system will come from mesoderm, correct? Yes. Versus peripheral nervous system, the signaling to the conduction system is going to come from neural crest cells from the ectoderm. Good question. Muscles are mesoderm. All muscles, smooth, cardiac, skeletal. Bones, all bones except for cranial bones or skull bones. Skull bones are ectoderm. All other bones are mesoderm, and connective tissue is mesoderm. Okay. All right. Keep moving. So then gastrulation. So once we have the 3 germ layers formed, gastrulation is essentially taking those 3 germ layers, developing them, and then starting to fold to actually create a fetus. One of the first things that will happen is the epiblast to create your 3 layers. Your epiblast cells are going to invaginate. They're going to create this essentially dip inward through this primitive streak, that's what this is a primitive streak, to form your 3 layers. So again, remember your 3 germ layers all come from the epiblastic layer, which was one of 2 layers in week 2. So epiblast cells are going to move inward, they're going to invaginate and move out to form all 3 layers, all 3 germ layers. Day 15 is when the primitive streak forms. So right at the beginning of week 3. Day 16 is when the 3 germ layers will form from that primitive streak. And day 19 is when your midline notochord forms from your mesoderm. Okay, again, all of these things are happening during week 3, right? So gastrulation, you could say as a whole, occurs during week 3 of embryogenesis or development. That includes forming the primitive streak, creating the 3 layers, and creating the midline notochord, which is going to help our next step in the process. So we're still in week 3. Then once we move from week 3 to week 4, we start to see neurulation happen. Essentially, once a notochord is present, so once notochord has formed, we can start forming the nervous system. Neurulation can occur. Neurulation, formation of the nervous system. So neurulation is essentially creation of the neural plate from overlying ectoderm, because the neural plate is ectoderm, okay? Day 19, when the notochord formed from mesoderm, it's just the guidepost. The midline neural groove and bilateral neural crest regions will form in the ectoderm based off of wherever the notochord is. So if the notochord's in the wrong place, then we're going to have a neural plate develop in the wrong place. That could affect symmetry of the body because we are having this identically right down the middle of our developing embryo. And so that's part of why if we saw a symmetrical issue, it may not be compatible with life if it happened too early on. Because if we had a full development of neurologic structures on one side but not the other, that would be incompatible with life. So this person, at this point, we're in week 3, would likely not even know they have conceived, right? At this point. They might, but they might not. So there is one genetics break that's important in this process, and we'll keep back to it. The sonic hedgehog gene, SHH, induces this change creating essentially this neural groove here, these neural crest regions, which are essentially these little regions that are bumping up, all a part of this neural plate. Sonic hedgehog gene is who actually induces this process. So then if you had a mutation in this, you're going to have issues with neurulation. Essentially, it's located at this zone of polarizing activity. Well, that sounds very aggressive, but essentially where our limbs will form, base of the limb buds, and it's going to help with anterior and posterior axis patterning and sensory or central nervous system development. So any issues with creation of an anterior and posterior axis, so if something developed on the wrong side, or if our central nervous system didn't develop fully, we could look at the sonic hedgehog gene, SHH, as an issue. Then on day 20, we're still in week 3 technically here. We'll move into week 4 here shortly. The neural groove will develop. So we see a groove here. They'll then move into a neural fold, and neural crest cells will break off from the rest of the ectoderm and move deep into the ectodermal layer bilaterally. I don't know if I have that on this page. I might have it on another one. But essentially, you'll see these cells that are going to start to move downward on either side. Okay. On day 22, you'll see creation of the neural tube from the neural plate. So essentially, you see this dip down, and then this greater dip, and eventually these two sides, these crest cells will bind together. They're going to be essentially drawn together like a magnet, and you create this neural tube. That neural tube now has fully broken off from the overlying ectoderm. This is overlying ectoderm. Still develop our epidermis and all of our external structures. We now have ectodermal tissue that's created the neural tube that can help us to develop our central nervous system. It's now separate. And then you'll have, again, that notochord below it, which is essentially just the guidepost. Like that's just what I said, these neural folds will connect. Okay. That's neurulation. That's week 3 to week 4. Formation of the neural tube, separation of neural crest cells. Okay, week 4, the week of 4s. So we're going to get the heart beating because it has 4 chambers in week 4. You can actually now see heart activity in via Ativus, and upper and lower limb buds will form 4 limbs. So the week of 4, you get 4 limbs and 4 chambers of the heart. So you get a beating heart in week 4. I go a little bit more in depth in the other PowerPoint about organogenesis for the heart, but essentially When you're at about 18 days, you have your head, cephalic, and your caudal regions. You have this cardiogenic area and these little blood pools. These are primitive blood vessels. Blood flow is going to be through 2 endocardial tubes. They're going to fuse together. They're going to be drawn together and they'll fuse, creating a primitive heart tube. You're then going to kind of continue to have this structure, and it's going to start turning in the shape of an S, and it turns upon itself to create the 4 chambers. And that's the fold of the heart. All these sections, if you want to take time to memorize them, great. I think they're lower yield than endoderm, ectoderm, and mesoderm. So I'd say I would focus on that first and then maybe go into the heart next if you're going to focus on another region. But you can see now that truncus arteriosus actually in play in this developing heart and how it's directly helping move blood through the developing heart in the embryo. So now we've jumped forward a few weeks. We're at week 4, now we're at week 7. During week 7, we have obliteration of the vitelline duct. Why is this important? Because this duct connects the yolk sac to the midgut lumen. And during week 7 of development, that's when that portion stops. So we start to have more development of organs at this point. So we don't have to have as much direct communication to that yolk sac for nourishment. So we're having more tissue and fluid exchange. Okay, so that's week 7. All right, what is the gene that's expressed at the base of the limbs in the zone of polarizing activity? The only one we talked about. Sonic the Hedgehog, good. If you had to remember one gene, it would be Sonic the Hedgehog gene or Sonic Hedgehog gene. Sonic Hedgehog gene regulates patterning along our anterior posterior axis. Then week 8, we have genitalia. This is when we can tell male and female characteristics. That's why around week 8-ish, week 10, week 12, that's when we do our first ultrasound typically to see if we can characterize the developing fetus. We will talk about this development in a few slides, but you'll see here that this would be the undifferentiated, where there's no androgens present or there haven't been any influence yet, and then differentiation into female organs, where no androgens are present, versus when androgens are present, we can see the development of more male organelles. And so we will look at those processes here shortly. All right, that's your base week up to week 8. So I would work on that first. These are some support structures that are important to know when it comes to our embryogenesis. So this is a break from our 8 weeks of development. We're going to come back to it in a moment, but I wanted to talk about a few support structures that you should have kind of definitions of. So the placenta and support structures. This is the placenta, the decidua basalis, and amniotic fluid. So there's 2 fetal components of the placenta. So when we implant, we're going to back to that beginning implantation bilaminar disc. We have a cryptoblast, which is the inner layer of the chorionic villi. This is where we create cells, versus the syncytial trophoblast. This is the outer layer of the chorionic villi. This is where we synthesize and secrete hormones. Essentially HCG, which is going to tell the corpus luteum to secrete progesterone during the first trimester before the placenta has taken over control fully. This whole area, specifically the syncytial trophoblast, does not have MHC1 expression. So you're not having any tolerance concerns because the body's not even able to see it or recognize it. It can't bind to it, so it won't recognize it. That's part of how we have maternal tolerance occurs at our beginning developing embryo. So being able to understand cryptoblast creates cells, syncytial trophoblast is synthesizing and secreting hormones. And we're not talking about our actual developing embryo. We're talking about the actual components that are implanting and supporting said embryo in this image. The maternal components that develop into the placenta that's important to understand is the decidua basalis will be the portion that derives from our endometrium. It also is going to be the portion that will give maternal blood, specifically in lacunae. Think of lacunae like in our bone, how we have all those different areas, those different spaces where blood flows through. Kind of similarly here with our maternal blood supply. Anyone who's looked at like a placenta and seen it look like the tree of life will kind of know what I'm talking about. But these different components of blood flow to the fetus is really what we're talking about with this decidua basalis layer here. Amniotic fluid would be the other area to understand in the amniotic cavity. mainly where it comes from. That's where I've seen these questions asked. It's derived from fetal urine, mainly in fetal lung liquid, and it's cleared from the fetus by swallowing, mainly, as well as a little bit of intramembranous absorption. Because remember, we're not undergoing direct respiration at this point. We're actually breathing in and out fluid at this point because we're not fully breathing yet, right? We're not actually undergoing respiration until birth. That's when the first breath happens of air, which we'll look at. Some other fetal circulation structures, I would say these are a little bit more high yield than the maternal structures in the placenta. But first, what two layers make up our bilaminar disc? Epiblast and hypoblast. And which one develops into the germ layers? Epiblast. Great. Epiblast and hypoblast. Epiblast becomes your germ layers. And it's during week what that this happens? Two layers during week 2. Excellent. Your second week. So why do we even care about the yolk sac? Mainly because of what it develops into. So your yolk sac, your allantois, and your urachus. Your yolk sac will develop into the allantois, nice French word. It's going to have an interabdominal remnant called the urachus. This is going to be a duct between the fetal bladder and the umbilicus. I'm trying to find my image that shows a good picture here. Oh, here we go. So up here, we still see allantois, and then as we develop, urachus will be here. It's essentially helping the fetal bladder itself and the umbilical cord communicate. After birth, this portion is obliterated, and it will be replaced by the median umbilical ligament, which eventually will be covered by the median umbilical fold of your peritoneum. So adults would not be able to view the structure anymore, but that's the remnant, essentially, where your belly button is. This is week 3 all the way up to week 12. Your umbilical cord. Of all the things we've talked about since week 8, the umbilical cord is the one structure I see tested on more commonly for embryology of these other support structures, mainly because of it has some interesting components. It has 2 arteries and 1 vein. So it makes it kind of different. 2 arteries, 1 vein. It's derived from the allantois. You can see here, we have our umbilical cord moving all the way here, connecting up to the fetus from maternal circulation. The 2 umbilical arteries are returning deoxygenated blood from the fetal internal iliac arteries to the placenta. Okay, so remind ourselves, what's an artery? What does it do? It's bringing blood where? Away from stuff, right? And what does veins do? Bring it back, right? Does it matter about oxygenation status at all? No, right? We can have arteries that are deoxygenated. In the body, we have some, right? We have veins that have oxygenated blood. Now, typically, arteries carry oxygenated blood, veins carry deoxygenated blood. That doesn't matter in the definition. Arteries are carrying blood away from the heart in our central circulation, and veins are carrying blood back towards the heart, right? So when we have our umbilical arteries here, we're moving blood, we're moving deoxygenated blood, we're moving it away from the fetal heart back to the maternal circulation, okay? And when we have our veins, we're going to have veins that are going to take blood back to the heart, back to fetal circulation. The umbilical vein has oxygenated blood in it because it's bringing oxygenated blood from mom to the fetus, right? Arteries are taking deoxygenated blood from the fetus and pushing it back to mom. So that's the whole point of umbilical cord circulation. It's to bring oxygenated blood to fetus and take away deoxygenated blood back to mom, because the fetus is not doing its full circulation, right? Or else it would be alive. Not doing that yet. It needs that umbilical cord, needs that support from mom, from the maternal supply while it's in utero. There's one umbilical vein, which is supplying the oxygenated blood from the placenta to the fetus. This drains into the IVC, the inferior vena cava, via the liver or the ductus venosus. And we'll see there's 2 different drain pathways. Okay. Now we get into some weeds. So if this is already a lot of new things that you have not studied, I would ignore this whole next section and just forget about it, leave it, plug your ears. If this is all review and you're like, I feel like I know this kind of stuff in general, then you can lean into the pharyngeal apparatus and support structures. There tends to be some questions about this on the NPLEX, which is why I'm covering it, but it's lower yield than germ layers. Okay, so I'm kind of trying to give you some ranking structure so when you're studying on your own, you know what to lean into first, second, third. So this would be 3rd or maybe 4th Okay. So the pharyngeal apparatus. So this is talking about how we're going to develop all the stuff that occurs kind of like right in this region. There's a lot of things that develop all in this region, and it provides a lot of good test questions. And so that's why it's often asked about, less than germ layers, but more than probably any maternal structures like the placenta. So the pharyngeal apparatus talks about this whole structure here. It includes clefts, arches, and pouches. So the region, we can see it's cap. Cap covers outside to inside. So cleft, arches, pouches makes up cap. The clefts, which we can see here, like 1, 2, 3, 4, these are clefts, okay? They come from ectoderm. There's 4 of them. They also could be considered grooves. So you could see that used interchangeably. Arches, we can see the arches here, these little outpouchings. They come from mesoderm or neural crest cells. There's 5 of them, 1 through 4, as well as 6, okay? There's 1, 2, 3, 4, there's really no 5, and then there's 6. So that's your arches. These are they could be muscles, arteries, bones, and cartilage. That's what they develop into. And then you have pouches. Our pouches are kind of over here, these in pouches. You have 4 of them, they're from endoderm. So cap from external to internal, clefts are ectoderm, arches are going to be mesoderm and neural crest cells, and then pouches are endoderm. Okay, so now what do these things mean? We're gonna look at the clefts first. So again, clefts, ectoderm, there's 4. So these are clefts or grooves. So there's 4 pharyngeal clefts. The first develops into your external auditory meatus. So that's a 1-to-1. So I'm like, okay, well, I could learn that. That's one thing, right? Second through the 4th develop into temporary cervical sinuses. These go away by proliferation of your second arc mesenchyme. So if I was going to learn any cleft, I would just learn number 1. The first cleft becomes our external auditory meatus. That's the only cleft I would know. It's the only one that stays into adulthood. All right, take us out of clefts. Going back to what we already know. During fetal development, what forms the central nervous system and brain, while what typically forms the peripheral nervous system? So what's the brain, central nervous system? Someone say it loud. They're all ectoderm, yes, good. Neural tube is which one? Central. And what's the peripheral? Crest, yes, absolutely. Neuroectoderm or neural tube is going to be your central nervous system, and neural crest cells is going to be your peripheral nervous system. They all are ectoderm. So whoever said ectoderm, yes. Okay, now our arches. So our arches are next. So we have our arches here, 1, 2, 3, 4, and 6, because there's no 5. So this is your memory little thing, if this helps you. When at the restaurant of the Golden Arches, children tend to first chew, then smile, then swallow stylishly, or simply swallow and then speak. Okay, you can remember that, great. I don't know if that's super helpful, but if you remember it, awesome. Cranial nerves that are involved in this area is cranial nerves 5, 7, 9, and 10, which kind of makes sense if you think about it. Some sensory stuff and also chewing, right? Cranial nerve 5. 7 is your facial expressions, facial nerve. And then 9 is going to be like swallowing, deglutition is 9, and tongue movement. And then your vagus nerve helps with speaking and all other kinds of things. It's cranial nerve 10. These cranial nerves grow into the arches. They're derived from neural crest sensory cells and neuroectoderm, the motor. So neural crest for the sensory, and then neuroectoderm for the motor components. Why is there no arch 5? There technically is, but it makes no major contributions developmentally, so we don't talk about it. 1 through 4 and 6. So our first pharyngeal arch is chewing. This is cranial nerve 5, the trigeminal nerve, the mandibular branch, helping with our actual chewing mastication. So it is the muscles of mastication, the temporalis, the masseter, the lateral, and medial pterygoids. There's also some other muscles involved. I don't have a fancy mnemonic for those, but there's the mylohyoid, the anterior belly of the digastric, tensor tympani, anterior 2/3 of tongue, tensor villi palantini. If you are a visual person, this picture, the yellow is associated with the first arch, the red with the second, blue with the third, and then the purple with the fourth. So that might be more helpful visually. How much should you memorize these things? Not a lot, right? I would probably know first pharyngeal arch, 2, cranial nerve 3, the mandibular, or 5, the mandibular branch, and the muscles of mastication. I probably wouldn't commit that to memory. I'd say, well, if I remember it, great. If not, it's fine. Okay. I also have some cartilage associated with some of these areas, like your maxillary and mandibular regions. Those are going to be the cartilage portions that are going to be associated with the first pharyngeal arch. And remember, our arches, all of our arches are mesoderm. So that's why we're seeing muscles and cartilage being formed here. It's mesodermal tissue. Versus our initial regions, we were talking about ectodermal tissue. So we're talking about mesodermal tissue here. The second pharyngeal arch is smile. Cranial nerve 7, our facial nerves, is involved. So any muscles of facial expression, so your stapedius, your stylohyaloid, your platysma, your posterior belly of your digastric. You'll also have some cartilage. It's called the Reichert cartilage. Again, how much would I recommend memorizing this? If it's like, if anatomy is your jam and it's there, great. If not, I would say no, second pharyngeal arch helps you smile. So it's the facial nerve and any muscles that help with facial expression. That's how far I would go. Third pharyngeal arch is swallow stylishly. So this is cranial nerve 9, your glossopharyngeal nerve. This is your stylopharyngeus muscle. That's why the stylishly is there. It's the posterior 1/3 of tongue as well. There's also the greater horn of the hyoid cartilage, but I would probably remember glossopharyngeal, stylopharyngeus, swallow stylishly. Your fourth pharyngeal arch is to simply swallow. This is cranial nerve 10, your vagus. It's actually a specific branch, the laryngeal branch, makes sense it's up top. And it's going to be your pharyngeal constrictors, your posterior 1/3 of tongue. And it's also this one, the cartilage that's involved is cartilage used to sing and act. Your actinoids, your cricoid, corniculate, cuneiform, and thyroid cartilage are involved in your fourth pharyngeal arch, or simply swallow. And lastly, oh, I had a question, whatever. Okay, moving on. Sixth pharyngeal arch is to speak. This is your cranial nerve. Again, vagus nerve. All intrinsic muscles of your larynx, except for the cricothyroid, because that was already involved. So any of your muscles to help you speak. You also have cartilage used to sing and act here as well. Your actinoids, your cricoid, your corniculate, your cuneiform, and your thyroid. Okay, those were the arches. Now we have the pouches. Okay, this is endodermal tissue, endoderm. So 1 pouch is going to be your ear. 2 will be your tonsils. 3 is going to be your inferior parathyroid. And then the dorsal portion. 3 ventral will be your thymus. And 4 is going to be your superior parathyroid. So these actually, the 4th pouch and the 3rd pouch actually switch. They flip in the adult form with how the fetus essentially folds. So the first pharyngeal pouch is your ear, your middle ear, your eustachian tube, your mastoid air cells. So the endodermal structures of your ear, because again, this is endoderm. So first pharyngeal pouch is your ear. Your second pharyngeal pouch is your tonsils. So again, the lining of your palatine tonsils. That's your second. Your third, you have 2 portions. Actually, yeah, you have 2 portions. The dorsal wings are going to be your inferior parathyroids. Your ventral rings are going to be your thymus development to T cells. Those structures will end up, like I said, below the 4th pouch. And then your 4th pouch is your superior parathyroids and parafollicular cells of your thyroid. Okay. So that's your pharyngeal apparatus. Lots of stuff. You see why I say it's lower yields, right? It's a lot to remember if this is new information. I would say, like I said, spend a little time on it. Don't spend a lot of time on it. There will be maybe 1 to 2 questions max on this on your exam. All right, something that could be on your exam, the umbilical cord contains how many umbilical arteries and veins? Good, and arteries have oxygenated or deoxygenated blood. And then obviously the vein has the opposite. Excellent, good. All right, So I want to spend the last 13 minutes on differentiation of genital embryology, just to talk about these differentiation patterns. And I'll show you where the other embryology organogenesis lecture is if you want to find it and look at it yourself. So female anatomy, genital development. So this is the default development if there's no androgens that are present in the system. So if no androgen is influenced, this is the pattern that the fetus will develop into. The mesonephric duct, and I apologize, this is very small, but the mesonephric duct is here, this red structure. So this will degenerate. The male remnant of this in a female anatomy developed fetus will be the appendix testes. The paramesonephric or the Müllerian duct will develop for females, and that's here, these gray structures. Again, sorry about the smallness. They will develop into all of the female internal structures. So things like fallopian tubes, uterus, the proximal vagina. The distal vagina actually will become from the urogenital sinus. So the distal vagina comes from different tissue, not the same tissue. So you can see here the gray structure. This is the gray structure here, the gray structure here, the gray structures here. That's what they're developing into. Male anatomy development, it needs androgens to develop, which we'll look at the next slide for the androgens involved. But the paramesonephric duct will degenerate. The female remnant in males is the Gartner duct. The mesonephric duct, therefore, and therefore the Wolffian duct, this is this red structure, will stay developed. It'll develop into the male internal structures outside of the prostate. That's developed from a different tissue. So you could think of this as SEED. I'm sorry, it's a terrible acronym, but it's actually kind of helpful. Seminal vesicles, epididymis, ejaculatory duct, and ductus deferens. So those are the things that will form from the mesonephric or Wolfferian duct in our male anatomy fetus. The androgens that are needed include, so if a fetus has the SARI gene of the Y chromosome, it'll produce testes determining factor. This will lead to testes development. Sertoli cells and Leydig cells. So Sertoli cells will secrete Müllerian inhibitory factor or anti-Müllerian hormone, which suppresses the paramesonephric duct to prevent female secondary sexual characteristics or primary sexual characteristics from forming. And then Leydig cells are secreting androgens, which will actually stimulate development of the mesonephric duct. All three of these have to go correct to have development of male genitalia. If you are a flowcharty kind of person, this is talking about end differentiation, what the mesonephric duct comes into, and then ovaries and testes, and essentially the hormones that can influence each of these different structures. So we have the XY SARI or XX no SARI gene. So ovaries versus testes. Our testes cells are Leydig cells versus Sertoli cells. Leydig cells secrete testosterone. You can follow through the flow chart. But this shows you primary sexual characteristics and secondary sexual characteristics. All right. Okay, this is good. What is the order of our branchial apparatus components from outside to inside? Cap. So what's cap? Crest, arches, pouches, right? So cap covers from outside to inside. Clefts, not, I think did we say clefts or crests? I think we said crests. Clefts, arches, and pouches. We were just thinking of neural crest cells, like traumatized us. So clefts, arches, and pouches. So clefts, ectoderm, arches, meso, pouches, endo. If you're going to get a genital, like sexual differentiation question, it's probably going to be what's the undifferentiated and then what's the actual differentiated analog. And so this is a table for you if you want to commit those things to memory. One helpful thing is it does show the difference between like the urogenital sinus and what they form into. How much you want to spend time on this depends on your other areas of expertise in anatomy, right? It's going to depend on how much time. The gubernaculum, I just wanted to say, because it's fun, it's a band of fibrous tissue. The male remnant anchors testes within the scrotum. The female remnant is the ovarian ligament and the round ligament of the uterus. So that's when I see the gubernaculum tested on, is asking about which female ligaments are present from the gubernaculum, or what is the developmental embryologic component that developed into the round ligament or into the ovarian ligament. And gubernaculum would be your answer. These are some references and resources. I have a couple videos here if this is like not your jam. These 3 are actually really helpful to go through. These would be the textbooks you could find a lot of these images from. And then I wanted to show one last thing since I have a few minutes, and then I'll let you go. This extra material, I didn't plan on lecturing about it in class, but it does go through, just so you can kind of see what it touches on. It does go through heart morphogenesis, so talking about how the heart develops and how chambers develop. So septation of chambers, septation of ventricles, outflow tract formation, so how all the different valves are formed, the aortic arch derivatives, so the different kind of blood vessel components you can see here, like they actually are color coded, heart embryology, what it gives rise to. And then probably the one thing I would look at on this would be fetal circulation. This would be the one thing if you're going to focus on an area that's more intensive, more in depth for organogenesis, it'd be looking at these 3 shunts, the ductus venosus, the foramen ovale, and the ductus arteriosus. The ductus arteriosus is where blood enters the fetus through the umbilical vein. It goes through the ductus venosus into the IVC, which it can therefore bypass hepatic circulation. Some blood will go through the liver, but not all blood has to. So that's a great shunt that the fetus has. The foramen ovale is where most of the high oxygenated blood reaching the heart is directed through. So you can see this here, right atrium to right ventricle to pulmonary trunk. That's where some blood goes through. But in the fetus, you'll see a lot of it will go right atrium, foramen ovale, directly into the left atrium. This can fuse or remain patent, right, at birth. And if it remains patent after birth for an extended period of time after birth, it can lead into pathology. And then deoxygenated blood from the superior vena cava passed through the right atrium, right ventricle, main pulmonary artery, ductus arteriosus, here we go here, down to the ascending aorta. And this shunt is because of high fetal pulmonary resistance, because obviously this is before we're breathing air. So the pulmonary trunk, the pulmonary tree has a lot more resistance at this time. Then after birth, that resistance decreases. And this ductus arteriosus closes and becomes that ligamentum that we saw earlier. This is crazy lung development. I would not worry about committing this to memory at all. I just wanted you to have a resource. There are 5 stages. GI development, if you're like, what the heck is foregut, midgut, and hindgut? I have defined it for you and kind of when those things happen. And then a little bit more on neural development. If you're still confused about how the neural tube contributes to these structures, that's where we get into that diencephalon and teleencephalon that we looked at earlier. You can see this color-coded, kind of correlated to these sections. So I think I have it all. Kidney development's there, and then blood flow here. My last slide is fetal hemoglobin. Alpha occurs always, gamma goes away, and everything becomes beta. That's how you remember from fetal to adult hemoglobin. Alpha always, gamma goes, bye-bye, becomes beta as an adult. If you remember that, you'll probably get most of your fetal hemoglobin questions correct. Okay, go away and enjoy your life. I will see you tomorrow. We'll talk about anatomy. Be great. We'll laugh, we'll cry. Hopefully not cry.
Thank you.
Yeah.